Somewhere in the world, a mother dies every minute from complications of childbirth or pregnancy.
99% of these mothers live in the developing world.
When these mothers die, there's a 3 times greater risk that their little children will die before they are 5 years old.
2/3 of the people in the world with HIV AIDS live in sub-Saharan Africa.
In Africa alone, 10,000 pregnant women and 200,000 infants die from malaria every year.
This year, 10 million children will die from preventable diseases like pneumonia, diarrhea, and malaria before their 5th birthday.
These are the statistics of maternal and child mortality around the world. And it's all our world. At Jhpiego, we don't just see statistics. We see mothers, children, families, and communities. And for over 35 years, we have been innovating to improve the lives of women and families in developing countries and create a world where they will flourish.
These women do not need to die. These newborns do not need to die. These children do not need to die. And we know what to do.
Jhpiego is an international nonprofit that's affiliated with Johns Hopkins University. For the past 35 years, we've been bringing low-cost, innovative solutions to countries so that they can help women and families survive.
We take the creativity of Johns Hopkins University and apply it to the health problems of developing nations.
Being part of Johns Hopkins, you're working with the School of Medicine, the School of Nursing, the School of Public Health, and the School of Engineering, using all those health professionals together to look at solutions to help women live and to help children live.
Over 150 countries in Asia, the Middle East, Eastern Europe, Africa, Latin America, and the Caribbean have partnered with Jhpiego to improve healthcare for millions of families.
Jhpiego over the years has built relationships with professional organizations, medical schools, nursing schools, governments, communities around the world. We seek out these organizations in developing nations.
A lot of the work that Jhpiego does is to really work with the Ministry of Health to produce guidelines and standards and norms that are then disseminated and used by the providers countrywide.
Jhpiego also partners with the US government, the United Nations, foundations, corporations, and private donors to fund its all-important work.
The majority of care being done for women and children around the world is being done by nurses and midwives.
They are the frontline workers, and there are very few physicians actually in each of the developing countries. So midwives end up providing the majority of services.
The midwives provide care during pregnancy and pre-pregnancy. They also provide services for family planning.
We know a woman will be healthier and have healthier babies if she has family planning so that she doesn't have babies right in a row. So to us at Jhpiego, family planning is integral to saving the mother and saving the newborn.
Jhpiego works for simple solutions that are cost-effective, solutions that can be provided by the midwife working alone in remote and rural settings, solutions that are extremely affordable, solutions that will immediately save life. One example of how we innovate is our program in Thailand, where nurses are providing a very large cervical cancer prevention program.
We came up with an approach that down to the village, down to the health post in any developing country, we can train a midwife, we can train a nurse to provide testing for suspicious lesion of cervical cancer.
This test is a very simple test. It's the use of vinegar painted on the cervix. Can we train the nurses to look at the cervix and identify some lesions on the cervix that are precancerous? And once she has made that detection, then she goes ahead and treats it by cryotherapy or freezing the cervix.
This midwife, this nurse, is empowered to treat on the spot this woman who she may not see in another visit. So this, to me, is an example of how Jhpiego is providing countries with tools that can be used without the need for major investment in funding, without the need for high technology, without the need of high resources that countries do not have.
Some of Jhpiego's most critical work has been in HIV and AIDS in Africa.
Our impact in Africa is widespread. We have incredible commitment and incredible relationships with Africa.
Education, testing and counseling are at the core of Jhpiego's efforts.
Our work involves educating people about HIV/AIDS, offering the possibility for people to get tested so that they know their status. If they are HIV negative, then we educate them how to remain negative. If they are positive, we also educate them how to make sure that they protect themselves, that they protect their partners.
Infection prevention, particularly in health facilities, has always been a Jhpiego priority.
The objective is that the providers would protect themselves from contamination, but also they will protect their patients and their clients from getting contaminated at the clinic level. So what we do is we train them to how to disinfect their instruments, how to sterilize their equipment, washing hands between clients, and how to dispose of the medical waste.
Jhpiego also works with the community to provide treatment and support services for patients with HIV and AIDS.
It's a continuum of care, from prevention to counseling and testing, to treatment and to integrated services, reproductive health and family planning together with the community.
Improving healthcare for women and families is Jhpiego's focus in Afghanistan.
In Afghanistan, under the Taliban, there had been almost no training provided for female health workers. So in 2002, when Jhpiego went into Afghanistan, there was almost no midwife who was available to provide the services for women. And culturally, as you might expect in Afghanistan, women will not seek services from a male provider. So there was absolutely an urgent need to make sure that there would be female providers who would be able to be there at the time of birth and provide the skilled care that was necessary to save women's lives.
Jhpiego trained this midwife, whose practice is now flourishing, and this mother came here to deliver her first surviving baby.
I think the wonderful story about Afghanistan for Jhpiego is not only are we helping to develop a whole new group of health professionals, but these women that we're training for the first time are employed around that country. They have a job.
I think these midwives are becoming change agents in their own ways, and it's having a huge impact in terms of gender and empowerment within the communities.
If women don't survive, their children may not survive. The families will not be intact, a community will be apart, and a country will be affected. If a country isn't healthy, it affects the region, it affects the world. We are one world, and we have to look at ourselves as saying, as one world, we cannot have one woman a minute die in childbirth. As one world, we can't have one woman every 2 minutes die of cervical cancer. What I love about Jhpiego is its impact is much more than building the capacity of a country, bringing new knowledge and skills. Our impact is really being felt by these women and families out there. They know their lives are different now. They see the difference in having a healthy newborn, a healthy pregnancy. They see the difference in their life when they're on HIV/AIDS medication. They see the difference when, if we found pre-cancer during our cervical cancer screening, we've treated it, and now they're back home with their families, and they know they're going to live.
Today, we are working with experts from Africa, Asia, South America, and the Caribbean who trained with Jhpiego over the last 35 years.
More than 500,000 women have been screened for cervical cancer in Thailand.
Yesterday, a midwife taught by a midwife who worked with Jhpiego saved a mother's life.
We here, I was taught by Jhpiego everywhere we go around the world.
We are Jhpiego.